You're listening to the Unlocking Africa podcast.
If media reports health in the right way, then we have an opportunity to impact policy and health systems as a whole, providing healing as a directly practicing doctor. And now through media, I was just thinking about what would resonate with the community that we serve and the community that I come from. As African storytellers, as African media houses like yourself, we have to look for those stories of resilience and innovation and progress to be able to tell and highlight those stories.
Stay tuned as we bring you inspiring people who are unlocking Africa's economic potential. You're listening to the Unlocking Africa podcast with your host, Tessa Adamu.
Welcome to another episode of the Unlocking Africa podcast, where we explore the innovators, entrepreneurs, and leaders who are unlocking Africa's economic potential. Today, we're looking at a fascinating dimension of Africa's development story, which is the intersection of health and communication. My guest today is Dr. Mercy Korir, CEO and Editor-in-Chief of Willow Health Media. Dr. Mercy is an entrepreneur who's redefining health journalism in Africa. She's a medical doctor, award-winning journalist, business executive, and a recipient of the Presidential Order of Service Uzalendo Award for her impactful reporting during the COVID-19 pandemic. Dr. Mercy, welcome to the Unlocking Africa podcast. How are you?
Very well, thank you. Thank you for hosting me. It's a great pleasure to be on your podcast, and I look forward to the conversation straight from Nairobi, Kenya.
So let's start at the beginning. Your story is as inspiring as it is unconventional. You've transitioned seamlessly from medicine to media. What inspired that shift, and how has it shaped your vision for health journalism in Africa?
So my transition, or what really sparked the actual transition, dates back to 2011. I was just newly graduated as a medical doctor, waiting to go for my internship, mandatory 1 year internship, 2-week internship before one becomes fully licensed medical doctor in Kenya. And during that time, the doctors in Kenya had formed the Doctors Union, and we had our first strike at that time. And so we were agitating for very many things at the time. Of course, pay, but also just the work conditions in our healthcare facilities, the patients' conditions, their welfare. It was a lot of things. But the media coverage was just focused on that doctors want a pay rise. And that was everything. Even upon the resolution of the strike, the story was that doctors now have gotten the pay rise. But I was like, what about all of these other 95% of issues that the doctors have raised? And so by the time I was doing my internship and finishing, it kept nudging on me that, probably something can be done differently, because if media reports health in the right way, then we have an opportunity to impact policy and health systems as a whole. And, it goes back to the power of the pen, the power of the microphone. And so that is now what really led me to transition. But before then, I used to be interested in writing a lot of articles, and I was even writing during that strike period for doctors. But it was really just the media coverage that I thought we could do this differently. So upon finishing my internship, I did a lot of work as a medical doctor, a practicing doctor for a while. I went to study communications at the University of Nairobi. And after finishing that, I literally went knocking at the media houses and said, I have these qualifications, I think I can do this. And at the time, I was looking at doing broadcast media because I thought I can write. I'm not interested in development communication. Broadcast media is the one that looked like it would be challenging, or is the one that I would actually need hands-on training. And after 8 months or so, I got an internship opportunity at KTN, one of Kenya's leading media houses. It's usually the third leading media house in Kenya.
Yeah.
And I got an internship opportunity. And so that's why I started my internship as a reporter And by the time I was leaving KTN, I'd set up the Health and Science desk there. So that's my journey.
Fantastic. And after that transition and internship, you founded Willow Health Media, which I believe draws its inspiration from the medical willow tree.
Yes.
So how does that symbolism reflect the organization's philosophy?
Okay, so my community where I come from, we believe a lot in conserving nature and using nature to heal us. Like if you are feeling down, you take a walk in a forest or, in the nearby bushes and you'll feel rejuvenated. And I grew up with traditional medicine. Of course, I didn't know at the time, but when you are unwell, there was always a herb that my grandma and my great-grandmother would give us and you'd feel better. So many years later, becoming a doctor, providing healing as a directly practicing doctor. And now through media, I was just thinking about what would resonate with the community that we serve and the community that I come from. And at the same time, be providing healing in a different way. And I thought the willow tree could be one of those because it is said to have some medicinal value in itself. And also just the greenery of a forest provide healing. Trees are the lungs of the earth, And as an organization, our philosophy is to provide information, knowledge, and, useful things that people can do in their day-to-day lives to either live healthy or two, when they're unwell, have the right health-seeking behavior, go to the right place so that, people are feeling better. The second bit is we want to be able to engage with the relevant stakeholders and the policymakers, the decision makers, that have influence as a whole in the health system and in what they do, be it directly, providing healthcare or is health financing. We want to engage in that level so that through media and the work that we do as a media platform, we are able to influence and provide better health and well-being for our communities and the people that we serve.
As you mentioned, your philosophy is empowering people or health through knowledge. What does that empowerment mean for ordinary Africans who are navigating health information today?
For us, we see them in two ways. The first one is in the individual choices that we make. So when we started Willow, the government was rolling out in Kenya, Social Health Authority, a new way of financing or funding healthcare by providing social health insurance. And at the time, people didn't know what this was all about. How do I register? How do I pay for this? How do I add my children or, my spouse into this system? If I need care, where do I go? And as an organization, we did those kind of utility content so that you know where to register, how to pay up, and, be part of that so that when you need that care, you've already been sorted out. So for us, it's about providing that information that helps every individual make the choices that they need to make, the right choices, so that when they need care, then they have that information. And also some things could be just as simple as, if you do this kind of exercise, if you eat this kind of food, you'll be better. If you're unwell, this is the kind of place to be, so that people, when they're making that health-seeking choice, they have that information that empowers them. The other bit for ordinary people is for them to demand for better healthcare and to demand this from the policy makers, from the decision makers, from even, say, the hospital managers, the community health promoters, the managers and the supervisors, for them to be able to demand and provide a pool for better healthcare, as opposed to people sitting in boardrooms and deciding their own things and, pushing into the people. And one of the stories I can give an example of that we just did recently was one of the communities in Kenya, in northern Kenya, in Turkana. are very rooted in their cultural ways and their cultural beliefs. And when decision makers or people implementing programs would go with what they consider modern medicine, nothing was happening. But when they incorporated some of the things into maternal care, for example, when mothers deliver, they want to go home with their placenta. They don't want the hospital to dispose it, or the baby has to be named first before being breastfed. When they incorporated some of those cultural beliefs that people believe in, one, they saw increased deliveries in hospitals, and what happened was a reduced maternal deaths and reduced infant deaths. So it's about empowering communities to know this is our rights, this is what works for us. Whatever you design as healthcare, let it serve the community, so that there's that pool for better healthcare, better public health interventions for the communities.
So if we narrow down and look specifically at the work you do, you're navigating medicine, media, business, which are three demanding worlds that require different kinds of leadership and skill. So how do you balance your analytical, evidence-driven mindset as a doctor with the creative demands of storytelling and communication?
That is it still is, and initially was a very hard thing to navigate, because as a doctor, you are used to things happening in a certain way. But when you're telling stories, you let people tell their stories. You don't bring in a lot of medical jargon, a lot of, all of those things. So over time, I have learned to let people tell their stories, let people own their stories, because at the end of the day, everyone sees things differently. Everyone experiences things differently. We may be in the same place, but our experiences are very differently. How we see things are very different based on our upbringing, the society around us, many things around us. So one of the things I have really learned to do is let people own their stories and tell their stories in their own way. And where it needs now contextualization or objectivity, that's now when we come in with the mindset of a medic, or, that scientific mindset, and, merge the two. And in any case, anyway, during our training in medical school, we were always told that, medicine, yes, is a science, but most of it is an art, because you're always dealing with people, interacting with people, and no one day is the same. So it's about just marrying and incorporating those two into the storytelling that we do on a day-to-day basis. But it hasn't been very easy for me. But it's been almost 10 years in this field, so I think now I am comfortable in the storytelling, mixing my both minds, the creative one and the medical one.
As you said, it's been 10 years and you've managed to make it into a sustainable profession, livelihood for yourself, turning health media into something that's impactful and also an enterprise. With that in mind, health journalism isn't always seen as something, I guess, which is commercial or a commercial sector. So how do you see it actually contributing to Africa's broader knowledge and innovation economy?
Let's just think of health alone.
Yes.
Health is an enabler of development, just like education, for example, or infrastructure. So health is an enabler of development. When your communities and societies are not healthy, then you don't have a productive society. So I see journalism as that bit of health as an industry that amplifies stories, communicates information, could be of policy, change, something new. And so journalism, or how I see it, is now an enabler of healthier societies, healthier communities, healthier decision-making in regards to health. So I see health journalism being a very big contributor to the development of the health industry. If you look at what happened to all of us during COVID-19, journalism was at the center stage, because how else did we know what is happening in different parts of the world? How else did you know that, there are these vaccines, there is this that we need to do? It's because there was information sharing going around, and journalists like myself played a critical role in making sure that whatever is happening in the global stage is translated, one, to a language that people understand and is contextualized to, the different experiences of the different communities and the different people that we serve in the country. So I see journalism being an integral part of, development of health. That said, for me, it's not just health journalism in the traditional sense of, a journalist is reporting on health, but really health journalists that are grounded in proper knowledge of health. And this is because of the digital disruption that we are seeing across the world, more so in this part of the world. Everyone with a smartphone takes to it and they say anything and everything. And if people are gullible, then they would believe everyone. So health journalism, for me, then would be the people who are grounded, who have a track record in reporting, and so they are authoritative and authentic and believable to the audiences. And that is now the kind of health journalism that we are looking for, because there's all manner of information online that people can get, but which one is it that is grounded in the principles of journalism and also grounded in proper health knowledge?
Thank you for that. So you highlighted that health journalism is an enabler of economic development, economic growth. I think despite that, high-quality investigative journalism tends to be expensive. So what business and revenue models are you exploring at Willow Health to make what you do sustainable?
So Willow Health Media is a not-for-profit organization. So one of our revenue models, of course, is grants and donations, people that are willing to support the kind of work that we support because they see the value and the impact that it has. So in this end, we are looking at working with like-minded people and organizations that value quality journalism, one, and quality investigative journalism, such that they can directly fund the production of those stories, or two, be able to train our journalists in doing the right quality health stories or health content. And three is also just partnering with us and hand-holding us when you're doing stories, so that we are not just looking at revenue in terms of monetary, but revenue can also be in kind, where if somebody puts a certain percentage of, say, logistics or what's needed to be done, then you're able to give your expertise and experience, and at the end of the day, you get that quality of story. So we explore all of those ways to be able to fund the work that we do. It's not easy because generally media landscape across the world has been suffering terribly because, well, again, the digital disruption. So it's been up to the innovative newsrooms to come up and be able to survive through this. And so the same thing that has been happening globally has also been happening in Kenya. Media is really struggling. So we have to really think out of the box, think differently about how we fund our journalism and how we fund our stories, so that we continue providing the same quality of information despite the challenges that are happening in the media industry and the media market at the moment.
So keeping on the theme of partnerships, the Gates Foundation has supported your work. How has that partnership influenced your growth strategy?
Of course, the Gates Foundation supporting us has really been a big boost for the organization, because then we have been able to focus on the work of health journalism, give it time, which most of the time you don't have when you're in your regular newsroom, because you're always in the rat race, chasing stories, what's happening, breaking news. So it has supported our work in that we are able to now focus on the profession of journalism, focus on the profession of doing health stories that are really in-depth, well-researched, and quality stories. So that really has been a big growth, not just as an organization, but also for our journalists and the journalists that we have within our fold. And people can learn, and this is what I've picked, in the few years I've been in the industry, is when you do something good, when your work is good, reputable, you'll get support. The right people will see it. The right kind of people will come and partner with you. So one of the things is that for us to remain focused in the profession, be as professional as possible, of course, be accurate and as truthful as possible in our stories, but most importantly is be consistent in building the work that we do and building the brand. And I've seen that has really helped. And of course, the support of the Gates Foundation has built our brand even better. It has given us a confidence that we didn't have before, because now we can stand in spaces that previously maybe we couldn't get airtime to, and, be able to speak with other people and speak with other funders, speak with other like-minded individuals, and actually start advancing conversations in supporting the kind of work that we do. So it's really been very, very great support for us. And, we hope to work with the Gates Foundation for as long as they're in business, for the next 20 years or so.
You've built a business with impact at its heart, and I guess that makes me curious about how you're using innovation and technology to bring that impact to life. With that in mind, I was wondering, what ways are you leveraging digital platforms and media storytelling to bridge that gap between health knowledge and action on the ground?
So we have been very deliberate on two things. So when we look at the demographics in Kenya, we have people that are diehard consumers of traditional media, where they want to see you on TV or they want to meet with you so that they know you actually are real and you do these kind of things. And then we have another community or set of demographics, which is the majority, the youth, who are online. TikTok is big in Kenya. WhatsApp, for example, is big in Kenya, and Facebook. So what we have done as an organization is have both robust social media presence and also have physical presence. How we've done this is we are primarily on our website, digital platform, and also on all social media platforms where, all social media platforms that are Willow Health Media. So what we do is when we do our stories, we'll have some versions of the story on the website. Another version will be on YouTube. Something else will be on social media, depending now on the target audience. So some of the content will be for the younger audience, say on TikTok. Another audience will have their content on LinkedIn. So we make sure that we are present, addressing the different audiences in the different social media platforms. That's one. And then secondly is to have physical presence. So what we have done is hold town halls on topical issues. So one of the ones was the major issue on the social health authority or the social health insurance scheme that the country introduced. So we went on ground, different cities, set up physical location. It was streamed live and also on social media, and we did stories on it digitally. But now we are able to meet our audiences physically on location. But most importantly for us, because we look at impact, was part of our panelists who are these decision makers, the people who run the county governments, the Ministry of Health. So have these people actually interact with the audiences, which are your everyday people like you and I, who are part of the audiences, and so be able to interact, raise their issues directly, and have a few things they're sorted. And we saw that from that kind of interaction, one, we get direct feedback. Our audiences got direct feedback on some of the issues that were ailing them or, challenging them, and they're being able to actually be sorted out. But also now on social media, now we are able to address directly what our audiences on social media want. So it's been very important for us to make sure that apart from being robustly present digital, that we also have some presence on ground. The other way is, have high-level, discussions, webinars, roundtable discussions where we bring in, these various groups so that, apart from all of this that we do, at the end of the day is what kind of impact do we want our stories to have? After we've had our stories, can we advance and continue also these conversations in other ways and formats? Yeah.
Thank you for sharing that. You've detailed how technology and social media is transforming the way health content is produced and consumed across Africa. There's also a negative element to this, which is the fast-paced and sophisticated use of misinformation and other kinds of digital noise that we're seeing. So how do you ensure you reach the audiences that matter with the right type of information?
Of course, the era of misinformation and disinformation is quite challenging. We're in an era where when you see a video, first of all, you have to confirm, is it real or is it AI produced? And nowadays are really good. You can hardly tell, what is what. So things are moving fast. And as an organization, what we do is, of course, keep up with what is happening so that we remain relevant. But key for our audiences is to have that consistency, have a certain kind of style and way that we do our things so that our content is also not so mixed up with all kinds of, noise that is happening in the digital space. How we make sure that our audience get that? When we publish any of our stories, any of our content, what we've seen is we have loyal audiences that know if we need this kind of things, if this is happening, this is the kind of place that we come and, confirm and see if this is actually true. So we have our loyal audiences who will always come and consume our information. Secondly, is what I was talking about earlier, that we know who is our audience on TikTok, we know who's our audience on WhatsApp, we know who's our audience on Facebook, LinkedIn, and we tailor our content to them. So it could be the same story, but we're picking an aspect of that story that we know is relevant to you who's our audience on Facebook. So of course it requires a lot of work. Our digital teams does analytics every day. They look behind the scenes to see who is our audience there, what is it that they like, so that we make sure we respond and we answer to what our audience is like. And that's really how, for any business or anyone in the media business, that's how to be relevant and to remain relevant by consistently and constantly being of use, for lack of a better word, to your audiences.
What type of economic impact do you believe this type of health misinformation or disinformation has on African communities?
Of course, it does have a big impact because from COVID-19, I remember on WhatsApp, you would get a very long message that starts with, according to Dr. So-and-so. And you'd find, like, for example, I don't know about you, but here you'll find you in a village group. Most of the people are not as well educated, but even the well-educated people were falling prey. And in a group of 1,000 people, if that message is sent and it has started with, according to Dr. So-and-so, you shouldn't mask. You can imagine people will not mask because it sounds like it comes from a place of authority. So, of course, the impact of and that's just simple misinformation. We haven't even gone to how people are misusing AI to, push a certain narrative. So, of course, the impact is directly on people's health. The second one is, for some of these bits, they sell what I call snake oil. They're snake oil merchants. So they'll say, according to Dr. So-and-so, this particular medicine is good for your knees, for example, your joints, and it is 100 pounds. People will sell their animals, whatever they have, to get that 100 pounds to be able to afford that medicine. So what have you done? You have bankrupted a family. You have deprived them of, a source of food or income because they're looking at something else. So when I look at it at that micro level, it's direct. Of course, at macro level, it is big. And one of the things that we are seeing now in Kenya, for example, is vaccine hesitancy, which was something that was unheard of. Like for as long as I practiced as a doctor, you didn't need to convince mothers, fathers to bring their children for vaccination. But right now, you actually have to, and you find others that say, why should I vaccinate my child? So you can imagine what the impact of that will be for future generations. So when you start think about it from a micro granular level to a global macro level, then, the impact of misinformation is big. And that's why I'm a strong believer in that the future of journalism, and not just health journalists alone, but journalism in general, will be pegged on people who are grounded on the subject matter. So for health, for example, it will require people who have some knowledge of some grounding in any of the health fields, nursing, medicine like myself, pharmacy, whatever it is, some background in medicine. Business will require people who've understood or undergone some economics, for example. And that, for me, I see as what the future of journalism will be, because then at that point, people or journalists will be able to speak with authority and be able to sift for their audiences what is true from what is fake and misleading.
So if we continue with the theme of society and economic development, over the decades, I guess even before we were born, we know that Africa's health narrative often focuses on crisis, disease. How can media or current media reframe this to highlight the resilience, the innovation and progress that we are currently seeing?
First of all, our training in journalism, media, all of those courses needs to change. And I say it needs to change because when I was doing my communications course, you're told that news, when it bleeds, it leads. News is when man bites dog, not when dog bites man. So the training, we are wired to look at, the crisis, the bad things that are happening because we know that is news. But as African storytellers, as African media houses like yourself, we have to intentionally and deliberately look for those stories of resilience and innovation and progress and Africans doing something. And those stories are all over the place. We have to be very, very intentional in telling those stories and shaping our own narratives based on, how we see things. We are the ones who live in Africa, who are born here. We know the different nuances and the different, things that happen here. So we have to have that deliberate push to be able to tell and highlight those stories. And I'm encouraged because from the data that we see, as much as you'll get very many clicks, views on, the negative stories, people will see once and they'll not look at that story again. But our positive stories, the uplifting stories, we have seen that audiences come back again, they read, they share. There's longevity in the consumption of, the positive stories, the stories of resilience or innovation or the good things happening in Africa. And so for me, it's encouraging in that as much as the others will give you something, it's like a one-hit wonder. But these good, feel-good stories of Africans doing well, are stories that actually audiences want to see, want to read, because every day, if everything is happening bad around you every day, then people will lose hope. But when there is something good happening, then everyone wants to be associated or wants to relate with something positive that is happening around them. So my encouragement for yourself, for myself, and the people in this storytelling for Africa is that we have to shape the stories that come from us guys. And if you think about it, when we are long gone, when people come like, archaeologists to find out what are these people up to, do we just want our future generations to find that things were bad, terrible, happening wrong? No. We also want them to come and see that there were heroes and heroines that were present from this continent.
Thank you for sharing that. You noted that the training for journalists must change in order to reframe and, I guess, bridge that gap. But what do you think are the biggest gaps that we're seeing in health communication, specifically between, say, policymakers, the private and public sector?
I think what I see is that depending on who the policymakers speak to or listen to, the decisions they make will be tailored towards that group. Because, anyway, granted, everyone will always push for their own agenda and interests. So, one of the gaps for me is having all of these groups read from the same script. And the same script for me is what is in the best interest of an everyday person. The challenge that I see, or not really a challenge, but I think the people who are higher, the policymakers, people who are big in the private sector, I think what they forget is that at some point they'll go back to being ordinary people, everyday people. So if some of the decisions were made listening to feedback from everyday people, or that is what is informing their decisions, then I think things would be a lot more different and a lot more better. And so how this would happen is to have a medium where everyday people can relay their information directly to the people who need to listen to that. And good thing is, nowadays you ideally should go through, your representative, in parliament, for example. But the good thing is nowadays with social media, some people have direct numbers to some of these people. You can directly talk to them. So I think people reading from the same script is one of the biggest issues that really needs to be addressed. Of course, it's not a one solution fits all, but I think it's one of those things that needs continuous improvement, needs work continuously, so that, at the end of the day, we have something that works for all of us. And something that works for all of us usually is that thing that works for the most vulnerable and the underserved in the communities in the country.
So if we move from current issues, gaps, and look to the future, I'd love to hear where you see health journalism in Africa in the next 5 to, say, 10 years.
Where will it be? I think we'll see more narratives from Africa by Africa. Because if you look at what's happening across board, everyone is so engrossed in what's happening in their own country, globally, and very little time to what other people are doing unless it is directly affecting them. So what I see is more room for us to be able to tell our African stories. I see more Africans in the global stage advancing this narrative, because if you look at it, I believe the future is Africa because we are a young continent. So I believe the future is Africa. So we'll get to see more stories, more content from this side. So then that goes to say, I see the future of health journalism in Africa being bright. But my caveat is, if only whoever is in the space of health journalism at that time is grounded on the subject matter or has an understanding in one way or another on the subject matter of health.
Looking closer to home, as Africa's first dedicated health and science newsroom, what does success look like for Willow Health Media in the next 5 to 10 years?
Mm-hmm. So one, I see success for us will be if we have that agency and autonomy on health journalism, one. Two, as an authority in health journalism, both as storytellers and also as trainers of health journalism. So as a center of excellence for health journalism in the continent, not just in Kenya. So I think if we get to achieve that in the next 10 years, I should be ready to retire.
I think you're far too young to retire yet, Dr. Mercy.
Retiring, yeah, that is.
Fantastic. Thank you for sharing that. Last question.
Quote of the week.
As people, we often have quotes, mantras, African proverbs, or affirmations that keep us going when times are challenging or when times are good. Do you have one that you can share with us today?
Just one or very many?
Hey, you can do two. Go on.
I'll give you one, which I really like. So I'll give a bit of context for this first. So I grew up in rural Kenya. It's called Kericho. Very, very humble beginnings. So that's partly why I relate to this. So in Swahili, this saying says, kidole kimoja hakivunji chawa. The direct translation is one finger cannot crush a louse. So lice.
Yes.
So one finger cannot crush a louse. So if you think about it, for you to be able to crush one, you actually need two fingers for you to be able to kill it. And I like this partly because I 100% literally relate to it. But secondly, because it always reminds me that I cannot do it alone.
Yes.
I cannot walk alone. I cannot achieve everything that I've done alone. I need like-minded people to work with me, to support my work, the stakeholders, the partners, the people who are usually willing, to tell their stories through us. We wouldn't be where we are if people are not entrusting us with their stories, if people are not entrusting us with their knowledge and expertise as experts in their various fields. If, for example, we didn't have the Gates Foundation supporting the work that we do. So it's always, for me, a reminder that I need people. We need people around us for us to be able to be successful in, the things that we do.
Dr. Mercy, thank you for sharing your journey from medicine to media. Your work at Willow Health Media is demonstrating what it means to empower communities through information.
Thank you.
Fantastic work.
Thank you. Thank you very much, Tessa, for having me. You're also doing an amazing, amazing job, giving Africans like myself a voice, in your podcast, in the global stage. So this is the kind of things that excite me about what Africa can do, what Africans do. And so, we should continue doing this.
Brilliant. I agree 100%. And I will be keeping a close eye on how Willow Health Media progresses and some of the fantastic work that you're doing, and look forward to many more partnerships and collaborations in the near future.
Same here. Thank you very much for your time.
Also, to our listeners, remember, unlocking Africa's potential isn't just about infrastructure and investment. It's also about knowledge, wellness, and informed citizens. Thank you to everyone who has listened and stayed tuned to the podcast. If you've enjoyed this episode, please subscribe, share, or tell a friend about it. You can also rate, review us in Apple Podcasts or wherever you download your podcast. Thank you, and see you next week for the Unlocking Africa podcast.